And I said, if I give you an honest answer, you will think I'm a spineless politician still running for office. Because the honest answer is yes, no, and maybe. And let me explain what I mean by that. If you teach economics at the nearest college, the answer is yes. Because the economic definition of a recession is 2 consecutive quarters of negative growth. We're going to have 2 quarters of positive growth. So the strict economic answer is yes. If you live out there in the real world, if you're in the construction business, for example, we got some members of various construction unions here tonight, the unemployment rate in construction is 17%. Unemployment went over 10%, and if you count the people who are underemployed and the people who are quit looking, that is, the people that work part-time want to work full-time, and the people that just quit looking so they're not in the figures, it's 17%. For those people, this recession is not over. For small businesses whose revenues have not recovered, it's not over. For people who are worried about whether they can keep their kids in college, it's not over. For people who are part of the 30% that lose their health insurance at some point during the year, it's not over. So the answer is, in the real world, it's not over. And you should know that typically this happens. When we, in the post-Depression, post-World War II recessions, normally what happens is stock market picks up for about 6 months, and then the GDP numbers are positive, like we're doing now. Both those things have happened. And then only after about a year of that do people finally have enough courage to start hiring people. If you look at what the small businesses have done, they're basically holding on with level or declining sales because they've cut the cost of labor. And productivity has gone up higher because mom and pop operations have mom and pop doing 60 hours a week are thinking other things that'll be productive. And if you know what it's like to lose a job or lay somebody off, it won't surprise you that after a recession this severe, it's hard for people to get the courage to hire them back, because like in the small business world where most Americans work, if you lay somebody off, you know them, you know their spouses, you know their kids, you know what their family problems are, you know what dreams have been crushed. It is an agonizing experience for both the people that lose their jobs and the people that lay them off. And people are scared to death to do that twice. They don't want to burn that bridge twice. So they have to have clear evidence that the economy's coming back. The maybe answer is this. Twice in the last 25 years, we've started to come out of recessions and something bad has happened and it's slipped us back in for a little while. It was like a false start. So that's why the honest answer is yes, no, and maybe. But the big answer is yes. And the urgent task of the President, and one of the 5 big things I want you to think about, this is what I believe we Democrats have to deliver on in order for the President to be able to say at the end of an 8-year service that people are better off when I quit than when I started, our kids have a brighter future, and we're coming together. I think we have got to turn this jobless recovery into a job-full recovery. And we have got to create jobs in doing it. Now, there are lots of things we can do, but I can tell you that based on the work I now do in my current life and my experience in the White House, there are lots of things that we can do. There are over $900 billion in cash reserves uncommitted to loans in America's banks now. I know this TARP program is wildly unpopular, but you're going to make a profit out of that, because the banks are paying back that money with interest, and you'll actually get more money out of it. But we need to use things like the New Markets Tax Credit, which gives extra incentives for people to create jobs in high unemployment areas, and we need to put together projects and take them to the banks, and the President needs to ask people to loan. We need to put the construction workers of the country back to work by retrofitting every big building, every college, every university, every city, every county, every state building in the entire country, every hospital, every office building, every public housing unit. There's money to do that, and there's money in the bank. You know, you can get an energy service company like Johnson Controls or Honeywell or Siemens to actually guarantee those savings. And therefore, banks should be willing to loan that money and let the big buildings pay back, or the universities and colleges pay back only from their utility savings. If we did it, we could put 1 million people to work in 6 or 8 months. We've got to support a job-full recovery, not a jobless recovery. We couldn't do it before now. First, they had to stop the bleeding, but now we can do it. And if the Congress and the President come up with a plan to do it, we got to be there to back them, and we got to tell the American people what's going on. Then we have some long-term challenges, and I think there are basically 4 big challenges. If you want America to recover as a middle-class country, keep in mind, before this economic collapse, 2/3 of the American people's after-inflation income was lower than it was the day I left office. Median income before the collapse was $2,000 lower than it was the day I left office. And after inflation, health care costs had doubled. After inflation, college costs had gone up 75%. Why? We didn't create any new jobs. We didn't have a strategy, and we were not competitive. And therefore, I want you to think about these things. Number one, we have got to do something about health care. And let's just assume, and when you go out and you talk to independents and Republicans and conservatives about this, they may not really care that 16% of our people don't have health insurance, or that nearly 1/3 of Americans at some time during every year don't have health insurance, as long as they got it. But they should care about this. America spends 16.5% of our income on health care. No other country spends more than 11.5%. That's Switzerland. They got the plan I tried to pass. Canada spends 10.5% of their income. Every other big economy, Germany, Japan, the United Kingdom, all of our competitors spend between 9 and 10% of their income. Once you get to a $15 trillion income, you do the math. If the difference is 6% in our income, that means we start off every year writing a $900 billion check to our competitors. So we're going to give you this advantage as we try to rebuild our manufacturing base. We're going to give you this advantage as we try to come out of this horrible financial crisis. We're just going to give it to you. And you say, well, but we surely get something for it. We do. They insure 100% of their people. We insure 84% of ours. And we spend 50% more than they do. Well, the ones that have it must have something. Well, in the last 2 international ratings of healthcare outcomes, we rank 35th in the world. Colombia, with all the drug lords, ranks 22nd, and they only spend 5% of their income on health care. Now, that does not mean we don't do things well. We're great at early diagnosis and treatment of cancers compared to other countries. We are great at dealing with the consequences of severe heart disease. I'm Exhibit A. Otherwise, somebody else would be giving a speech tonight if we weren't good at that. We give you, by and large, unless you're uninsured and get stuck in an emergency room for what is not an emergency, you can get if you have insurance, you don't have to wait as long here as you do in other places. And when it comes to health care, Americans have ADD. We don't want to wait. We want it yesterday. That's all good. And we got millions of good people working in the system, the doctors, the nurses, the paramedics, all these people are good. But we have a broken delivery system. 30 cents on every dollar goes to paperwork. That's approximately $220 billion we spend more than the next most expensive country in the world, which is Canada. Everybody else, for most of our competitors, we spend $300 billion more on paperwork than we would spend if we had any other country's system. Our delivery system is highly expensive because we always pay for procedures. We pay by the procedure, not for people to be cared for, unless you belong to a plan where you pay up front. The Mayo Clinic plan, for example, which everybody recognizes as superb, in its comprehensive sweep, is cheaper than 75% of the available coverage in America for the same amount of coverage. Not far from here in eastern Pennsylvania, the Geisinger Medical Group, you can enroll with them, and if you have any complication from any surgery that puts you back in the hospital within 90 days,